and welcome for everyone for joining us today. I'm Johanna Bergen, the Executive Director of Youth Move National, MOVE standing for Motivating Others Through Voices of Experience. Youth Move is the lead of the Youth Engagement Hub at the TA Network, and I serve as a co-lead for today's Young Adult Supports and Services Learning Community. Thanks for joining us all for today's learning session. Today's learning session is a part of that larger Young Adult Supports and Services Learning Community. As a reminder and a welcome for those of you joining us for the first time, this is a learning community that brings together individuals who share a common concern and passion for age-appropriate and appealing services and systems for young adults. It provides a forum to discuss and learn together about important and emerging trends to create better outcomes during the transition years and transition into adulthood. This learning community convenes all stakeholders in partnership with young adults, learning together as we interact regularly. Our goal is that individuals and communities experience support and success while working towards sustainable positive change. We invite you to join us online at Ideas at the Institute and specifically the learning community. There you will find recordings of our past learning sessions as well as resources organized by topic and accompanied thought work to provoke discussion and action in your own communities. You're welcome to engage with myself or my co-lead Gwen in that space, and we look forward to hearing your voices and your thoughts and questions on today's learning session as well as sessions into the future. I'm really excited about the presenters that are joining us today for our webinar. I am joined on the phone by Susan Wing and Heidi Holland, both of Massachusetts, both experts in this age population in their own right and graciously willing to share their knowledge and experiences in Massachusetts with us all today. I'll turn it over to Sue and Heidi to offer introductions of themselves and to just get started during today's webinar. As Tiara said, please use the chat box to ask us questions. We'll be moderating that throughout the session. Heidi and Sue?
Good afternoon, everybody. This is Heidi Holland, and I work at the Massachusetts Department of Mental Health. I work in our central office. I am overseeing, this is the second system of care grant that I'm overseeing, and that we have chosen to focus on transition age youth and young adults. And the current grant is called the Transition Age Youth and Young Adult System of Care Access Initiative, which is a mouthful, so we call it SCI. And our real focus is on to reduce barriers for young adult mental health access. And so as part of my role, I have taken the lead for our Child, Youth, and Family Division on this initiative of Reframe the Age, which was part of our changing the regulations and moving towards practice change.
Thanks, Heidi. This is Susan Wing. Hi, everybody. I am the Northeast Area Director for the Massachusetts Department of Mental Health, so I oversee the Northeast region of Massachusetts, all of our state-operated and contracted services for both adult and children, youth, and families. I'm one of 5 regional directors in the state of Massachusetts. I also am the principal investigator of the NITT-HT grant for transition age, the original, and also the 2019 HT grant as well.
Great. We're glad that you could all join us this afternoon. I see a long list of colleagues, some of whom I know, some of whom I don't know. But really what we want to do is just provide you with an overview of what has happened in Massachusetts over the last couple of years regarding regulations and practice change to really support and enhance success of transition age youth. So one of the barriers for young adults in accessing care, at least within our system at the Department of Mental Health, has been that we had in the past begun to utilize adult criteria at age 19 for eligibility or service authorization for DMH services. So whether someone was already in our child system, they might have had some success in terms of treatment within our child system, but when they turned 19, they might not actually meet the criteria for service authorization and would need to seek services elsewhere, or that it was a barrier for young adults to apply for services at all. One of the things we saw is we would see young adults, into their early 20s at a much more critical state of need, whereas if we were able to retain them or provide services for them during the age frame of 18 to 22, that might have been prevented. So we did a couple of things. So there was many years of discussion about how to change the age criteria, what needed to happen. Sue was involved with that going back many, many years before I came to the department, and actually was talking about we should really change it to 25. We didn't really get 25, although we would have loved it. When I came in to oversee our prior system of care grant, the commissioner asked that we begin a work group of stakeholders within our child, youth, and family system and our adult system. We all do work for the same agency, but I think that those systems have been pretty siloed. To really come up with some best practice and some how to address some of the barriers. And so the commissioner, reflecting upon the work of that group and upon our data, went ahead and we're not calling it raise the age, we call it reframe the age, because raise the age is a little more nuanced, and it's really about how do we really provide a framework for young adults to be successful within our system. So she went ahead and changed the regulation so that we could use child criteria up until the age of 22. And within that regulation, it provides an opportunity for a young adult to receive services in our child system, in our adult system, or a combination of each. And so I want to talk a little bit about how that regulation change helped us to really drive practice change. And these learning objectives for today really are about how you can think about using a regulation change to enhance services for transition age youth, how you're able to really think about the needs of your service system and break down silos with your adult and child stakeholders to effectively support and serve transition age youth and young adults. And really that hopefully you'll be able to demonstrate an understanding of the guiding best practices that we've employed and that you may already be employing in your state, but how you can maybe help those to spread more consistently across your system. So as I was saying earlier, within this regulation change, it gave us this opportunity for permeability within our system. It has really allowed youth and young adults to have more options within our treatment within our system. And it really has begun a process of practice change and culture shift. And probably the largest shift is the enhanced collaboration between our staff that works within our child, youth, and family division and our adult mental health services. And I know that Sue will be able to talk to that more directly as she oversees both of those within the Northeast. But that is the theme that we hear statewide from staff in the field who say, it feels really different. We used to only see each other at the holiday party, and now we're working together on a daily basis. And that has been really, really important in terms of what outcomes youth and young adults are receiving as a result of that collaboration. So the commissioner tasked that transition age youth work group that I was talking about earlier to really implement this strategy for regulation change. And if you look at this picture, it might not be coming out that great on your screen. I'm a big cat person. I have a couple of those of them at home, and if they get outside by accident, we're in the city, they're supposed to stay indoors, wrangling them back is a huge challenge. And my colleagues at DMH are sometimes similar in that the stakeholders have not really had a structured opportunity to work together in this way. And people come from lots of different perspectives. People have, real hesitation to have a young adult participate in adult program, or vice versa, to have someone in their early 20s still receiving sort of a child service. People have some skepticism based on being part of a state bureaucracy. So we worked hard in that work group to wrangle the cats and bring folks together. We had some really productive outcomes. The group has developed 2 frameworks, and those documents, I believe, are in your learning community pod, and Johanna and Tiara can let you know exactly where those are. But essentially, the groups in coming together really had, we had like a year-long focus moving into the time that the regulation was enacted July 1, 2018, to say, how can we use this opportunity to enhance practice and support the success of young adults? And that the first document was really that overall framework. And then the second document really focused on implementation. So both a strength and a challenge in the department is that each DMH area has kind of a unique character, a unique geography, demographics, culture. And so one of the things that was really clear in the work group was central office was not going to tell each area how to implement, but that what we did ask was that they use these documents to provide guidance on implementation, and that we work together in collaboration between central office and each area to support the overall goal. And so, so that is what we've been doing over the last year. We recently had the year anniversary of the regulation change. And, oopsies. Okay, hang on, I'm having a little glitch. And just as a background for those who are familiar with implementation science, we really utilize the implementation science model that comes out of the University of North Carolina Implementation Science Institute. We have at the Department of Mental Health that really helped us to use this model. And, you know, the real focus really is it can't all be driven by leadership, but leadership is key. And there's a lot of competency. There's a ton of expertise in our department about transition age youth. But that expertise, we need some consensus around how to really move forward. And so we brought that together, and organizational drivers. So that those are places and systems where we really have had to focus on what it is agency-wide that we're doing and need to do differently. A big part of that is data, which I'm going to talk about in a little while. But you know, our data systems were not seamless, so we're still sort of really trying to find what do we really need to know, how will we know that we'll become successful in this implementation, and what else needs to be done. So I just want to share with you that model. As with any practice change, folks often find this a very, very helpful model. And I wanted to talk a little bit about how we develop success indicators and metrics. This was something that probably we took 6 to 7 months within our work group to decide, so what's going to tell us that we're successful? And we are still sort of wrangling. We've narrowed down the metrics, and we are soon going to have a year's worth of data so that we can look at before the policy change and after. So I'm going to share that with you a little bit. We also have, locally, we're fortunate to have the UMass Medical School Transitions to Adulthood Research and Training Center right in our neighborhood. They've helped us in a number of pieces, but one was developing tip sheets around young adult engagement, family engagement, employment, education, and those, I believe, also are available for you to utilize in the box. And those tip sheets, part of the goal was internal DMH staff who may be more familiar with adults or more familiar with children now have a place that they can look to guidance around these particular aspects of supporting a young adult. We also did area forums where we really got an opportunity for UMass to share with us some national research and best practice, and at the same time we were able to hear from each local area what's been working well in their implementation. So that brings us to the area perspective for Northeast, and Sue Wing.
Okay, thanks, Heidi. So I'm going to talk about, this is our long road. I think Heidi talked about sort of our central office implementation task force, and it was a very energized group from members all across the state, all different roles, and people, I think, put a lot of thought and effort and energy into those discussions to come up with those implementation documents, because a lot of it was philosophy, and a lot of it was really addressing some of the fears that people had about their current systems, the current way of doing things. There was a lot of discussion about, are we opening the floodgates? What's going to happen? Are we all of a sudden going to be expected to serve a huge number of people that we just haven't served before, who have different needs or anything like that? And so this change really brought up a lot of fears. So Central Office really handed off, once we came up with that document, as Heidi said, handed off how is it going to work on the ground, and how are we going to address all of those issues that people have, in their day-to-day work. So, so the first thing I think that we really had to address is the fact that in Massachusetts, I've worked for the Department of Mental Health for 32 years. There's a lot of people who have worked for the Department of Mental Health for a long time. We have had many efforts over the years, many that I've, attempted with my colleagues to address the frustrations around serving the transition age young adult population, and all of the issues that come up, whether you're working in the Child, Youth, and Family Division or the Adult Services Division. And so, we had tried lots of fixes before, and, people were not feeling optimistic, I have to say. And when you start talking about this idea of permeability, permeability meaning an individual can receive from the full menu of services anything that Child, Youth, and Family offers, anything that Adult Service System offers. You can receive anything from that menu. That sounds like a fabulous fantasy, but really did not seem realistic to our staff. So permeable. Sounds good, but are you kidding me? That was a quote from one of my colleagues, the regional director, who, really, we literally heard that. So the first thing that we really started to do is empower staff. In the Northeast, we set our staff down, and all of our Child, Youth, and Family case managers and supervisors, our adult service case managers and supervisors, we had already implemented a transition age case management system in the Northeast. So those people and supervisors, and we sat them all down and we said, if we have tried many times, but we've never had a regulation change. And if this is going to work, it's because you all are going to make it work, not, the legal office or central office or the commissioner. They've done their part. it really is going to come down to the day-to-day nuts and bolts that we all do in figuring out, on the ground. We can't anticipate every move. We're really going to have to put forth what we think is right and then have people try things out and come back. So the idea that we did not have all the answers and we wanted the people to be working in the gray. Let's try this and see how it works and come back, and let's find a solution. Let's just proceed forward and work out problems as they appear to us. That is very, very difficult for people to do, I will just say. But I think people feel both excited about that, very empowered about that, and they also feel very nervous about that. But it was really important. We also wanted to then, if we were going to do that, is really allow ourselves to do simple but effective course corrections on the ground. So as people came up to barriers, to really sort of say, okay, here's how we're going to fix that. Because we proceeded forward before we had all of the nuts and bolts taken care of. So for example, in order to say that Child, Youth, and Family contracted services could serve people up to age 22, we actually had to change every single Child, Youth, and Family contract with our providers to have that, to include that language. And we had to do the same for our adult services contracts to bring the age down to 18 so that I actually really could offer, it was just a technical, a legal, an important piece. That takes a lot of work. Some contracts are up for renewal. We had to wait for renewal. We had to negotiate with providers before we actually formally did that to go ahead and ask them to do that for this particular individual ahead of time, ahead of the annual rollover of the contract, things like that. Those kinds of ways of helping the staff actually be able to do what we were asking them to do, I think was really, really important. So the local leadership available to allow our staff to consider the options and then not just rule them out because we haven't done it before, but really say, okay, how can we in this particular instance make that work? And so that local leadership to allow our staff the creativity and the flexibility to kind of work in that gray until we had it all figured out, it was really, really important and really exciting for the people who like to go to that creative solution, that's creative problem solving naturally. Other people don't go there naturally, but a lot of people do, and to sort of really reinforce that with the system, behind them was very empowering and effective for the people we're serving. So what we really focused on was to create a mindset of thinking outside of the box for every single staff. And when I say that, you have to remember, I don't know if you all work for or are involved in state-run services, but that's generally hard for us to do. We would like to do that, but it's hard for us to do. We're very structured kind of bureaucracy. So to sort of get people in this mindset is tough. But once you get people there, you really can see some fabulous things. The other thing that we realized is that we had to create opportunities to help people think out of the box. So we realized that, I'm going to make sure I'm not jumping ahead. We realized that the Child, Youth, and Family staff have a certain creative thinking around some topics, like, for example, different ways to engage families. They might be better at that than our adult services staff, and might have different ideas about what we can use, what services we can use, what strategies we can use than the adult service system. And the adult service system might have better and more ideas about, say, employment, what sort of employment services can be used, what, how to really engage people in employment, how to think about employment. So all of a sudden we realized that we had to make sure that every decision point we really had the people from both the child, youth, and family and the adult service system at the table. And we recognized where there were decision points. So every time we were going to consider talking about services, we were going to consider talking about what's available, we really had to have the decision makers, the people who knew what was available to offer, at the table. If you can imagine that being very resource heavy, it is, and it was. And what we talked to people about was that we are going to have to do this for a while until we have some cross-training. Because eventually, if we are at the table long enough with child, youth, and family people, we are actually going to start thinking like a child, youth, and family person, or we are going to start thinking like an adult services person, because we are going to have enough exposure. But we knew that in the beginning, and probably the next, I would say, we're 1 year in, and I'd say we've got another couple years to go to really get to that point where we've got the crossover. But those decision points are really important. The other thing that we really wanted to get through to our staff is to really embrace working with this particular population. Children, youth, and family, the children, youth, and family division, who is used to working with people, young people from ages 4 to 18, cannot really think about 19 or 20-year-olds as, fully operational adults, and I think that adult staff really can't think about, you can't think about young adults as just big children. I think you really have to get people into this idea that people are at the developmental stage that they are at, and they are emerging adults, and they are learning, and they're becoming independent, and they also have needs and families, and you have to sort of wrap that all up and sort of set the actual age aside a little bit. And so this particular population we know has special qualities that the rest of the people that we serve don't have. For example, we know that we have to creatively engage this population. We know that it's a population that research tells us is very difficult to engage. So we can't just set up our standard, this is the meeting time in the office, and expect that that's always going to work. We have to think about, many ways to engage. And if we try an alternative and that doesn't work, we have to try another alternative, something else that's creative. We had to get all of our staff really thinking about that. And we had to also get our staff thinking about low barrier access, which is something that we learned a lot from our first HT grant, that the bureaucracy that we have in the state is not necessarily conducive to engaging this population and really pulling in this population into the services that they're interested in. And so really thinking about how do we reduce all of those barriers as much as we absolutely possibly can. And so we wanted to get all of our staff kind of in that mindset. We also wanted each division to understand the value of what works for the other division. I think each division was very happy to say, oh, the Children and Youth Family Division, they, whatever, just fill in the blank. I think there's a lot of preconceived notions from the adult world about Children, Youth, and Family Services, and the other way around. Oh, Children, Youth, and Family sometimes thinks, oh, if a young person goes into adult services, are we making them a chronic mental health patient because they'll be in services forever? And there's always a big fear of that. And so we really had to have people really value and understand why the other division might take a different approach or might have different kinds of services. What do they do better? And what can they learn from what you're doing? And I think both divisions really had to sort of step back and kind of recognize the expertise of their colleagues in the opposite division. One of the things that we also did in sort of rolling out is we used success to breed success, meaning every time we had the opportunity to tell a success story, we did. We created as many opportunities for that to happen as we could. And the nice thing was that people were able to stand up. It really didn't take a lot except for setting aside time in certain meetings to have someone get up and say, I was completely surprised about, we had one person stand up and say, I completely did not expect this 19-year-old person to engage in services or respond to this alternate engagement strategy that we had employed. And she said, I was completely blown away at how effective that was in just the first meeting with this person. And it was kind of nice for everybody else to hear, because everybody else said, oh, all right, well, maybe this, maybe I ought to, give this a try. One of the things that that we did in our changing of services was we have an eligibility process to enter into services, whether you're, regardless what age you are, you file an application with us and you provide documentation. It's a bit bureaucratic, and but it's necessary because we, need to serve our target population. And what we decided to do for our young adults between 18 and 22 is we decided that to get to this low barrier, access issue, this engagement issue, we decided to have the very first contact, if we could, be a face-to-face contact, which we had done a paper process previously for people in the adult system. And so we decided for these young adults we were going to sort of meet with them with a child, youth, and family person and an adult services person right at the table, right from the beginning. And again, if you can imagine this was really resource heavy, it was. And our staff said, we can't possibly do this. And what we realized is that some of the time that we had spent trying to chase people with the paper process, we eliminated so much of that running around because we actually were striking while the iron's hot. We were responding really quickly after people had requested services. We were responding with basically all that we have to offer from both systems and really asking people, here we are, what are you looking for? How can we help you? And that was our first contact with people, and people that are young adults responded to that in such a way, asking for services that we were able to respond to quickly, because we had both people from both systems there. And amazingly, what you would think is we were able to engage people right away in services rather than losing people. The number of people that we were losing through that whole application process, or by the time we came around and said, yes, you're eligible for services, they were like, no, we're fine now, until the next crisis 2 months from then, and then, start all over again. So we're really, that, just that little change on the ground, was really huge. And again, the details of how to make that work, we really put on the staff to say, okay, let's try it. Let's just sort of leap. You tell me what barrier is in the way. And there are barriers like our IT system, all kinds of our paperwork, our eligibility application, what we were asking for people to provide to us, all kinds of interesting barriers that people ran into, and we just responded to those for the staff, and they were so grateful for it, which is why I think this whole process was different than anything else that we had done before. So, you want to pick up?
Sure. So like any implementation work, the proof is in the numbers and the data and what you're actually seeing as a result of that practice change or policy change. So here are the things that the group focus on that we are measuring. So Sue mentioned earlier about engagement for young adults being different. And there's a limited number of things we can capture within our mental health information system. We can capture the number of engagement activities, and one of the things we would expect is for a young adult that there would be more engagement attempts than for an older adult, but also the quality and the type of engagement being important. And so while they're in the process of applying, this is where we would lose a lot of young adults because they would just give up. And this was some of the strategy that Sue shared about the collaboration between our systems of meeting them face-to-face, which didn't happen necessarily in the larger adult system, was a strategy. And, we're in this era where young adults, if they have a phone, voicemail is not necessarily the way to go, but texting is. And we continue to have a struggle at our department that staff in the field do not have cell phones. And this has been a result of our legal office and HIPAA, and we're working on it. But I think that's going to be a really critical piece of engagement. But the type of engagement being important, kind of meeting them where they are, so physically in the community, going to them, but also meeting them where they are in terms of their readiness for treatment and understanding where they are in the process of change. And so I think those are really important in terms of the quality of engagement. We can't measure all that. What we can measure is the number, but those are some of the things that we're looking at that are larger. So the number of applications from young adults. One of the things that I mentioned that prior to the regulation change, there was a drop-off in applications. There was a drop-off in people who maybe had been in our child system who didn't even necessarily bother applying, but could have benefited from our adult service system. So we really were hoping to look at the number of applications approved that might not have been. We don't have the official number yet, but I did get to see some data just this morning, and it is looking good. We do have higher numbers of young adults that are being approved for services as compared to the previous 2 years. So that is encouraging. So the other piece, which is kind of tricky to measure, is the collaboration. We do have one agency, but we really have had separate service systems. And one of the ways that we can measure collaboration is we can tell that someone in the adult system and someone in the CYS system work together if a young adult was able to access services that are in both systems, a combination of services. So an example within our system, in the child system, there's something called flexible support. I can't remember the whole name of it, and it really is a flex service. It really is out there to meet their needs, and it might, our new flex system might include young adult peer mentoring, might include other kind of activities within the community to help them meet their needs. And in our adult system, one of our larger services is Clubhouse. So a young adult might benefit from either one, but really might benefit from that combination of services. The other way that we're measuring collaboration, we're working with UMass on a tool. It's a self-assessment tool for folks in the area and site offices to measure the quality of their collaboration. And we're about to start to implement that tool in the next coming months. I think that's going to be really an opportunity to measure things that aren't quantifiable in our mental health information system, but that we could look at in terms of that being one of our primary goals in the self-assessment tool. And then I think most importantly is, are they meeting their treatment goals at discharge? So those are some of the things that we're looking at. I think if you are looking in your own state to do a policy change that you're hoping that's going to result in practice change, I would maybe start with the data. I think we kind of backed into the data of what we were going to measure. Maybe start with thinking about what is it that, first of all, identify your challenge, like why do we need to do this change, and then what is it that we hope to see as a result. And so I would just encourage folks to start with that. And then we have some other early signs of progress. It's you.
Okay. So yeah, I think just as Heidi said, we actually had Heidi and some central office people come around, and each area had a forum after it was about 9 months into, say almost a year, and to really talk with staff and bring staff together and say, are we having success with this? How are people feeling about it? What other trainings do you need? We did an awful lot of training for staff, and really look at how things are going. We definitely are feeling like there's increased and higher quality engagement of young adults and their families. We were seeing increased collaboration with stakeholders across state services and schools. Our providers were really overall liking this as well. We didn't have any pushback from any of our providers. We were seeing a blending of resources and services from both the child, youth, and family and adult service systems. People were being creative and really were using the services from both systems. Collaboration on service authorization has been tremendous. That's our eligibility process. Our service authorization staff have been just so pleasantly surprised, if nothing else, and really relieved to, that we are just engaging people so much more effectively. We have we had in the Northeast a fair number of meetings that were really meant to sort of, we used to call them turning 22 meetings, which are basically people sort of coming up to age 22, or sort of a planning meeting across both divisions, and so we have refocused those meetings to really be a regular collaboration meeting. So it's not really about a handoff as much as it's about, let's make sure for each individual we are bringing the full complement of resources to the table. And if it means the system has to adjust, we need more of this kind of thing or less of this other kinds of resource, then we can make those systems adjustments based on those meetings. The tracking of individuals in a shared database, I think people were happy about that. We're really not losing anybody. The new procurement, we had several new procurements. And not only did we make sure that the age was correct, so for child and youth and family, we increased the age contracts, we increased the age, and for the adult contracts, we decreased the age of eligibility. But we also added in all kinds of issues to really address this population. Longer engagement time, for one thing. When you ask a contractor to, start billing, how long can they bill if they're still engaging? How long can they consider a case to be open? That really speaks to engagement. So if you don't adjust things like that in the contract, then you really are not supporting what the transition age young adult population needs. So I think that, and we also put in language about young adult parents and really serving those people more specifically. We put in language about technology and utilizing technology better to meet this population. So it was, so we really kind of got more to just the age, but really about who this population is. And then we also expanded our young adult peer mentoring, and not only the peer mentoring, but how we're using the young adult peer mentors and how they are working with, as part of the team and with the people we're serving. And so I think those were those were many of the signs of progress that we had on the ground. And I think just the feedback from our staff that while it's still, even after a year, we're still working some kinks out, people are overall really feeling like this was not just a short-term thing. People are feeling like this, we have made a culture shift, a real paradigm shift in the system. This does feel different than, the last time we got money and opened a new program or had some, small attempt to serve transition age. This really feels like we've changed the system. So people are happy.
Yeah. All right. So we're happy to answer questions. I mean, one of the things about having the opportunity to present this here and in Tampa is not to pat ourselves on the back, but to say, hey, here are some things that we learned. And, first you could maybe share with us maybe anything that you've learned in a similar vein, or what questions you have about how you could use a regulation change to begin practice and systems change. So I don't see anything right now in the chat box.
Yes, Sue and Heidi, thank you so much. So I'm also flagging and agreeing that we haven't seen any questions come in the chat box yet. So we welcome participants to take advantage of all of the knowledge and experience Heidi and Sue are bringing us to ask questions. And Sue and Heidi, thank you so much for all that you're sharing today and your reflections. I mean, I wrote at the top of the hour that regulation and practice change connection, and you ended with that so clearly as well. And I think it articulates for me that we need both shifts and changes on the ground when we're working with young adults, and we also need our systems partner at the table thinking about regulation and policy. So thanks for bringing that home so clearly for us.
Sure. The interesting thing about the regulations is that it's the law basically, and so people really feel like regulations can't change. Like we're stuck with what we have, and I think we are very lucky to have terrific commissioner level and secretariat level leadership to really support this. And so when we sort of had a tide of desire for change, and the commissioner really took the lead and said, yes, we can change the regulation, and that was the beginning of it. It was good. So it can happen.
I think it sounds like very bureaucratic and wonky to say, hey, we're going to change regulations, and it actually wound up being very empowering, to say, we did this, and it's structural, it's systemic, it's long-lasting, and there's so much that we could do now that we couldn't do before,
Yeah.
So anybody have anything that's happening in their state or questions for us?
All right. So Sue and Heidi, can I say thank you, and then would offer that your contact information is both included on the slide deck, and we'd really encourage questions and discussion to come to us in the learning community as well. The link is still here in the public chat. And so in terms of technical assistance resources, it's easy to make contact to us through that learning community. And we'd love to see your names as participants, and also encourage you to use that as a place to share what's happening in your state and ask additional questions and look for resources. The resources that Heidi shared that are in today's file pod will also be included in the learning community in connection to this recording, so you can check them out there. And as you leave the webinar today, we would really love to hear your feedback about how today's session may have helped you, or what you learned, or what you would be looking for in a future session. And so there will be a quick survey that will pop up in your internet browser as you leave today's webinar. And just can't encourage you enough to spend just 2 minutes giving us some insight about how today's learning session went. Thank you, everyone, for joining. And Heidi and Sue, thank you so much.
Thank you all.
Thanks,
you all.
everyone.
Thank you, Johanna, and thank you, everyone. We really appreciate your participating.
Bye.